Hello everyone. This is a case of two abortions in early trimesters, and she was evaluated with the HSG, but there was no significant finding. However, she was subjected for the diagnostic hysteroscopy. In the hysteroscopy, this is a mild subseptum less than one third of the cavity, and it was planned for the excision in the same sitting, and we preferably do with the cold seizures for small septums because hardly there used to be some blood vessels in these small septums, but one danger is there. If you will hit in the wrong plane and there will be some opening of the sinuses will be there, then the operations has to be cancelled because there will be bleeding and it will spoil the field. Well, the cold seizures is in the standard. We have to demarcate the lateral extremes and we have to go bit by bit, and we should not overcut in one plane, otherwise some sinuses will be opened and further procedures cannot be proceeded. And this is a simple rewarding procedures. Even if this can be done with the daycare procedures, and we have to be very careful in using these seizures because these are very small seizures with very fine fulcrum. So the big chunk of tissue should not be cut. A small tissue should be cut, and we must safeguard ourselves. Even no need of doing the laparoscopy if we are confident that these are small septums, and we should not overcut. And this is almost the area we have covered. The reddish looking structures are the muscles. So whenever it is visualized, then that is probably the last point of excision, and we should not go very nearer to the ostium, otherwise during the time of the healing there is chance of occlusion of the ostium. So this is a simple procedure. Hardly it takes around 15 to 20 minutes maximum, and it gives very good reward. There is controversy regarding these procedures whether to do or not because of the septum is an avascular area. So there used to be a implantation failure many of the times, and of course if there will be placentation will be there on the septum because of the deficits of the blood vessels. The placentation cannot occur properly, and there occurs to be either blighted ovum or the early missed abortions. They used to occur. So whenever they used to occurs, the evaluation of the cavity repeatedly, if it occurs, even if the early trimester loss, so evaluation of the cavity is mandatory, and even if the small septum or the subseptum is there, that should be excised because to prevent further losses. So thank you everybody for watching this video. Thank you all.